Primarily, we have three populations here. One, senior citizens, and they often suffer from diabetes, arthritis, kind of chronic medical conditions, and they need help maybe with taking their medicines, things of that nature. Then we have those who are just physically handicapped. They may be younger, but maybe they have a seizure disorder or they're wheelchair bound. And so they also need the medical supervision, but they might be younger in age. And lastly, we have individuals who have a developmental delay, and that can be a cognitive impairment. An example is Down syndrome. And they also benefit from the medical piece, but also the socialization piece.
Most of the clients, they all get their own special care in their own way. But like we have a client that needs wound care, his wounds are really bad, and we send him out for wound care. We do the dressings every day, but we have a wound care specialist check in on him. But there's a lot of cases where they need the special attention, and that's what they get.
We're in communication with their families, making sure their needs are being met, especially regarding their medical condition.
We do a full range of medical services, whatever they need. We do wound care, we do injections, we give insulin all the time. We give out all their medications that they need, but that also includes the education of the diet, what they should be eating, people that have seizures to make sure they take their medicine.
Besides that, we also attend to their needs, their social needs. We have activities planned all day long for them. So they're not just sitting at home, they have something to do, things that they enjoy to do, things they can feel proud of. When you're losing, maybe feeling in your hands, or maybe you'll have a physical limitation, if you can complete an art of some sort, that makes you feel proud. The alternative could be they would be sitting at home, and really this way they can exercise their mind and their body, and it's beneficial for all of them.
And what we're trying to do is empower people, be more independent. And I think activities helps with that. And I just want them to have a time out from their lives that aren't always easy. And I do think in many of our elderly clients, just to keep them sharper, to keep them engaged, helps them. So what we do is we adapt, and one of the things we do is we have a very large beach ball, and they bat it back and forth, and we can get a very large circle of participants with a full range of limitations.
I think we can make a difference with the people. Okay, I think me and all the staff try to make a difference with the lives of all the clients. We look for housing for them. Okay, if they have housing needs, the social workers look for housing, get people housing, or if people get their electricity turned off, that type of thing. We find money, grants for that to get turned back on. So there's a lot of things on the outside that we do help with.
One of my clients, she's 83, was born in the Dominican Republic, moved here years ago. In the past few years, we've helped her get her citizenship. We made the appointments, we helped her meet with the immigration lawyers, and she finally got her citizenship. And then recently, I was able to sit down with her and we registered to vote, and she's going to be able to vote in the next presidential election. To me, that's beyond basic needs. That is self-actualization. You know, it's wonderful for this woman who's 83 years old to have accomplished that.
I mean, when I come over here and I see some of the expressions and some of the smiles, it makes me glad I'm here. It makes me glad we're a part of it.